Hello, NAAOP members and friends. This is Peter Thomas. I'm in Washington, D.C. I'm the General Counsel of NAAOP and wanted to brief our members and friends on some developments that have occurred in the recent weeks. It's early June here in Washington, and there are some major debates taking place on student loans and other things. But in the House Veterans Affairs Committee, there's been two different hearings in the last 2.5 weeks on some very important reports that came out of the Office of Inspector General at the VA. The reports were mentioned in my previous briefing, and they involve prosthetic procurement. They involve the number and the system of prosthetic care in the VA across the country, how many amputees are served, in what environments, the different settings of care that the VA provides amputee and prosthetic and orthotic services. And then finally, another report on an audit essentially that occurred with respect to outside contractors that provide prosthetic services to the VA, and drawing some conclusions about overpayments and things of that nature. Those reports were issued in March, but the subcommittees of the Veterans Affairs Committee have just gotten around to holding some very important hearings on these OIG reports. And frankly, they've provided a great opportunity for the committee overall to hear from NAAOP, to hear from AOPA, to hear from other orthotic and prosthetic stakeholders and veteran service organizations and others, to comment on what these reports actually say and what they might mean going forward. A couple of takeaways. First off, the first hearing that occurred was with the Health Subcommittee of the VA Committee in the House. And that report focused on access to care. It also focused on the internal capacity that the VA has to provide prosthetic and orthotic services, and how that capacity has been increasing in the recent past as the VA beefs up its resources in that area. It also delved deeply into patient access to private practitioners, and really did scratch the surface and begin to examine the issue that is central to the Injured and Amputee Veterans Bill of Rights, which is House Resolution H.R. 805, which really would require the VA to post a list of rights for amputees and for others who need orthotic and prosthetic care in every VA facility that treats patients of this nature, and make sure that they understand that they have the right to go see the practitioner of choice and to access the technology that meets their needs. That Health Subcommittee hearing provided a great platform for us to get that message across, and our witness, who testified on behalf of NAAOP, named John Register, one of our board members, veteran and amputee himself, just did a great job in portraying his own experience with VA prosthetic care. He wanted to make clear that the VA prosthetic care he has received in hospitals and in O&P facilities that are internal to the VA was actually quite good. And he'd always been impressed and had been treated with dignity and respect by the VA in that regard. But the fact is that he lived 7 minutes from a contract prosthetist, and yet had to travel 70 miles in order to get new prosthetic care in the recent past. And that's one of the things that we brought up. The second hearing was in the Oversight Investigation Subcommittee. And that hearing delved into a section of the law, of the VA law, section 8123, that was passed in 1957, if you can believe it, which basically allows the VA to contract with any private practitioner for a veteran's prosthetic care, what they call in the statute prosthetic appliances, and without respect to any other provision of law. So it is a very broad grant of authority for the VA contracting officers to not have to follow the federal acquisition regulations or the VA federal acquisition regulations either. What's happened over the years is that definition of prosthetic appliances has grown, and the VA has considered many different types of devices in that category of care. And so there was some concern that perhaps the VA was not taking all of the proper routes to contracting and getting the best resources for the amount spent. I think, overall, the hearing went quite well in respect to explaining why the VA does what it does, and that it really stems from the prosthetic prescription by the physician, and stems from the amputee's choice in accessing the provider of choice. Not really an effort to kind of subvert the rules of contracting that the VA is bound to. These are really important hearings, and it lays the foundation for some additional work that hopefully the VA will carry out itself. We look forward to working with the VA on that. But if Congress feels that legislation needs to be addressed and passed to address this issue, then NAAOP will continue to do what we've been doing for several years now, and advocating for passage of H.R. 805, the Injured and Amputee Veterans Bill of Rights. We encourage you to write your member of Congress, to see your member of Congress, to invite them to your facility, and to promote this legislation as one piece to improving the system of care for veterans across this country. Thanks so much, and we look forward to the next webcast.